Do stairs, running, or jumping impact your life? Let's discuss how the lack of mobility in your knees can lead to a service-connected disability. Let's get into it.
Whiskey 9 Yankee 7 November Golf, over.
Let's begin by defining knee limitation or limitation of flexion of the knee. This condition refers to a restricted range of motion in the knee joint as veterans try to move or bend it inward towards the body. It's the second most common affecting veterans who experience knee injuries, develop medical conditions in the knee joint. How does knee limitation affect veterans? Well, it's quite simple. It comes with a set of troublesome symptoms, including pain, swelling, stiffness, and the frustrating inability to bend the knee fully. Okay, let's go ahead and move on to how the VA rates knee limitation. The rating for this condition under the diagnostic code 5260 ranges from 0% all the way to 30%, depending on a few factors. Veterans dealing with this condition often find it challenging to perform everyday activities, and it can have a significant impact in their quality of life. The cause of knee limitation varies from knee injuries to arthritis or degenerative joint arthritis. Specifically, it is based on how much the veteran can bend their leg. Here is a breakdown of the percentages associated with specific degrees of flexion. 0% if the flexion is limited to 60 degrees or more. 10% if the flexion is limited to 45 degrees or less. 20% if the flexion is limited to 30 degrees, and 30% if the flexion is limited to 15 degrees or less. So to receive the service-connected disability for knee limitation, veterans must provide compelling evidence. Remember the three things that we've been discussing over and over and over. One being in-service event. Now guys, when I talk about in-service event, I am not talking about I fell down the hill on this date and that is why my knee is hurting. What I'm talking about are things in your service that has caused your knee to deteriorate. So those 7 combat deployments, carrying that combat load with your kit, battle rattle, whatever you want to call it, will have a dramatic effect on your knees. Simply being airborne or a parachutist can have a profound impact on your knees. All of these are considered in-service events. So don't discount them and make sure the VA understands that you were in those particular situations or had that particular MOS or whatever the case may be. 2, current diagnosis. You need to have a current diagnosis. Either a doctor saying, in fact, yes, this is what's going on in his knees. He has degenerative joint disease or he has arthritis, or at a very least, be on a treatment plan for your knee. Whether or not they prescribe you lidocaine, pills, whatever the case may be, it has to be for your knee and speak to the issues that you've been discussing with your doctor on your knee. Last but not least, that nexus, the thing that links your condition and those symptoms to your military service. In some cases, it can even contribute to mental health challenges like depression and anxiety. One common secondary is somatic symptom disorder, which falls under the mental health umbrella. Okay, so as we have talked about in multiple videos, comprehensive medical evidence is the key. So when we're talking about limitation of knee flexion, we're talking about having a protractor actually saying, hey, yes, this is as far as I can go with my knees at the point of pain, x-rays showing some arthritis or damage to your knees, and detailed doctor's notes. All of these things will provide more pointed evidence towards your condition. Providing that in-depth information about those symptoms and experiences can definitely impact their decision on whether or not they'll give you that service connection. Remember, everything should be towards what that condition or that symptom is causing you to not be able to do on your day-to-day life or at your job or whatever the case may be. This is why it's so important for you to really document all of the symptoms and your pain levels associated with specific conditions, especially your needs. To receive a VA disability benefit for secondary conditions related to knee limitation, veterans must provide that crucial evidence that I was just talking about. Okay, in essence, remember to gather substantial medical evidence, thoroughly document those symptoms, and consider secondary conditions that may arise from your knee limitation. All of these things can drastically help you build your case to get you to 100% eventually. If you found this information helpful, please like, share, and subscribe to our channel for more valuable content related to VA claims and other topics that matter to vets. As always, this is Jay with TheCivDiv. Stay strong, stay resilient, and I'll see you later.